Good afternoon, all, or rather, I'd say good evening. So, without further delay, we'll start with the session. So, I welcome all the honorable panelists here, and as we all know, this session is about the innovations in capacity building. Capacity building is a very important area, particularly with respect to the national TV program. So to begin with, I'd request Dr. Vinay Garg to. We know that training the healthcare providers at different level. Considering you are at the helm of affairs, we would like to know what are the different challenges, what have been the biggest hurdles, and how has program worked to overcome the challenges with respect to the training and capacity building. Dr. Vinay Garg, please.
Thank you, Abhimanyu. As an HR manager, all of us would have faced this issue that what we expect out of our workforce has not been coming forth despite our best intentions and our employees' best efforts. So this is an issue wherein we have to bridge the gap between our expectations and the skill set the worker which we have employed for that purpose has to acquire. So as we are all working with people, we are all also working for someone else. This issue of there are just two major issues: the type of skill I have to acquire and the depth of knowledge I have to acquire. So these two primary issues are also affecting our functioning in National Tuberculosis Elimination Program. Given the kind of spectrum of work we have, say from private sector engagement to lab, to monitoring and evaluation, to designing treatment protocols, adherence, public health action, etc., which are jobs not to be done by one person. So first thing is, like, we have such a diverse workforce that we need to specify and make specific action-oriented courses for that particular cadre or that particular kind of work which we are expecting. This is point one. Second thing is, as with medical field, everything is evolving. Like in our last session, I myself only said that we are evolving and we are now becoming a more open program. So as and when the things are coming new, the private sector involvement was very less 15 years ago. So from alternate day regime, we have come to daily regime. Now treatment adherence part, certain technologies have come. So we are evolving. So one set of training material, or say, I would say capacity building material, etc., would be obsolete in a few months or max in a few years. Then it will take another full set of time of a few months to a few years to percolate down to the peripheral health. So I'll also answer the second part of it, that what we are trying to do is we are building a central content which is accessible to all. So wherever the trainings or capacity building is happening, for all cadres and all types of courses, there would be a central content which will keep on evolving depending on the guidelines how they are coming. And lower down, whosoever is accessing in real time.
Thank you, Dr. Vinay. So, Dr. Vinay touched upon the important area that there was this exercise about the identification of the gap, the capacity assessment or the training needs assessment of the needs were identified, and the cadre specific courses addressing to the needs of the staff, they were developed. So this is what has been done at the central level. Now I would take to the Dr. Sanjeev Lavania, so who is at the helm of affairs at the state level. Sir is the STDC director of Uttar Pradesh STDC. So sir, my question is about the operational challenges that you face with respect to rolling out trainings at the state level, and also at the district level you have an important role to play there. So yes sir, please share your experience.
Thank you, Abhimanyu, for giving me such opportunity on discussion of facing the challenge in Uttar Pradesh. As you know, training is the very important component of any program, because like the performance of the program can be given in a good way when your HR or your manpower is the highly trained. once you trained your staff, then your delivery of services and performance of the program is definitely will be good. Now, in relation of UP, Uttar Pradesh, as you know, Uttar Pradesh is the largest state of the country. It has 75 districts. 75 districts means a lot of manpower, right from the district tuberculosis center to Ayushman Arogya Mandir. So STS, senior treatment supervisor, lot of STLS, and district TV officer, medical officer, MOTC, the massive manpower, which we have to train in a program. It's a big difficult challenge in front of the Uttar Pradesh. Now, how we deal it? Now it comes. Actually, if you see then from traditional method of the training, it was a very difficult to training of such a huge staff. So innovation digital methods or integrating that newer technology in our traditional methods, so it help us in significant way to deal this challenge. So in what we have done in integrating technology with the traditional method, we adopted a modernizing training system with the help of union, and in our STDC we have installed the modernizing training system, in which we have the interactive board along with the few tablets. It contain a quantity of the 35, almost 35 to 40, along with high speed internet facility, and all modern gadgets. So with these gadgets, we started our training to our NTP staff. So in this way, we overcome on this challenge. So now we are giving the training in a much efficient or much effective way. This is the challenge we have to in this way.
Thank you, Dr. Lavania. Very beautifully, sir explained about the importance of the need for capacity building for the trainers who are there at the state level, and also how the state of Uttar Pradesh has used technology to deal with the challenges of reaching out to the wider audience, to reach out to the larger numbers. And Uttar Pradesh STDC has also established a modernized training unit also, which is a state-of-art infrastructure and which has been helping to reach out to the masses. So speaking of the modernized ways and the digital platforms, so we all know that digital learning is the way forward, and especially in terms of scalability and accessibility, as Dr. Lavanya mentioned. So my next question is to Dr. Dharmendra Yadav. So we all know that you are the one who is who is behind the revolution, I would say, Saksham. It is a digital learning platform. So how does Saksham bridge this gap and make the healthcare trainings more effective?
So
Dr.
first
Yadav.
of all, thank you, Dr. Manu, for Central TV Division for giving me this opportunity to interact with all of you and for your kind information. I'm coming from the National Institute of Health and Family Welfare, which is autonomous institute under the Health Ministry, teaching, training, research, innovation, and consultation for about all public health programs in the country is our mandate. So we have NIHFW has developed a digital learning platform, and that is LMS that is called Saksham on the behalf of Ministry of Health and Family Welfare. So this is the digital learning platform of the Health Ministry. It is used for the online learning and training for all the health professionals in the country. So this platform is used for by the various organization of the ministry, like NACO is using it for all the cadres trainings. Even Central TV Division has also used this platform and during the 100-day campaign, and they have trained. Congratulate to Central TV Division for using this platform, and with the help of this platform, they have trained around more than 25,000 health professionals of its cadre. So, going forward for the features which are available in Saksham, it is a self-paced learning. So it can also be used for the learning as well as training of the health professionals, right? Some quizzes and all the basic modules are there. Even you can also get health professionals can also get the certification from the training organization. So this is a unified and dedicated platform for the online training of the health professionals. So please, I request the Center TV division to make it more use for the rest of the part of the country. And accessibility and we will cover. Thank you.
Thank you, Dr. Yadav, for sharing the information and the features about the Saksham, which has been helping.
Even if I'm allowed to add something.
Yes.
So this Saksham proved very useful during our 100-day campaign. We were very quickly able to roll out few small courses for extremely peripheral our health workers, CHOs and ASHAs to begin with. So which enabled them to access them on their mobiles, and imagine the mammoth task we had to do, or a state government had to do, had they been forced to, or they had to do in 1 week train all their ASHAs and CHOs for all new parameters for regarding the campaign. So that kind of accessibility and simplicity of use, I would say, is very, very unique to this kind of platform.
So thank you so much, sir. And we are also, in the phase of like what we have learned from this 100-day campaign, that for more reach for the larger section of the health workers, especially ASHA and ANM, we have learned a lesson that for currently for the login purpose of this Saksham portal, we need email ID and other things. So what we have learned from this campaign, we have to make it more accessible by using OTP based, mobile based login OTP. So we are also working in that, and within few days it will be open for everyone. Thank you.
Yeah, thank you. So there has been constant learnings also. So program has taken services of the Saksham, and Saksham has also learned from the experience. And I must congratulate the program also and Saksham team also, that more than 25,000 people, healthcare workers, were reached within a very short interval of time to train them on the 100 days campaign. So congratulations, sir. So I also welcome Dr. Parija. Dr. Parija is with us. So, Dr. Parija, this is regarding the work your team has been doing, particularly with respect to training of the community health officers around the health and wellness centers. As we all know that they are the important cornerstone, important stakeholder for last mile service delivery. So, we just wanted to learn from you, like what strategies have worked in your, sphere of work, and what on-ground innovations have been effective.
Thank you. Thank you. And I begin by apologizing because I was caught up in a panel before this, which had my dear friend Malik on the panel board. So I had to wrestle the mic off him.
No problem,
so,
sir.
Yeah. So thank you for the question. Very pertinent question. And I'll just start with, so when we started this engaging with the Health and Wellness Center, the Ayushman Arogya Mandris, through the Nishtha intervention, the way we started was, we started with the basics. I mean, I firmly believe that you can only innovate once the basics are in place, right? You cannot innovate your way out of a drug shortage or a diagnostic shortage. Those are the basics. You can only innovate when the basics are in place and going well. Then only you can add. It is like the butter to the bread, right? It is not the bread, right? So very bad example, but yeah, you get what I'm saying, right? So the way we started is when we reached out to the health and wellness centers and we met this very young internet Instagram savvy community health officers, just freshly joined, raring to go, right? But then we realized that they didn't know what to do. Back then when we started 3.5 years back, the identification of presumptive TB cases from the health and wellness centers then was 1%. 1% of the presumptive TB cases in our states. We were there in 12 states. So when we tried to find out the reasons, we realized that the basics, in the sense they have Nikshay either not installed on this, or they have installed but they have never opened it, and now they're scared to open it. If they want to open it, they've forgotten the password, they don't know how to. So those were the initial issues that we tried to address. Basic, just sit down with them, log in with them, handhold them through that basic processes, and once they are familiar, then they realize that it is not that big a task, right? Then it took off, and then we made sure that review meetings, these were discussed, and then the health and wellness centers jahan se ho nahi rahe the, from where the notifications were not happening, we made sure somebody reached out to them. And you won't believe, in a span of 3.5 years, as we speak now, the percentage of presumptive TB cases being identified at health and wellness center from 1% is now 47%. So 47, is it a good number? Is it a bad number? I don't know. I don't know how much further it can go. But yes, I mean, if you put in the effort on the basics, things will improve. Once the basics are in place, that is when you try to figure out, what else can I do to bridge that gap, right? That's where innovations come in, right? So then we tried a lot of things during COVID. Also, we had this we had an iLearn platform that we had developed for COVID. So we put in a lot of TB resources there for those with smartphones. We put in a lot of resources for those with non-smartphones in consultation with CTD. It was called TB Champion Vani. So somebody who doesn't have a smartphone can also go through the resources and try to get quick answers and all. We did very, you've seen those Instagram reels, like 30-second, 40-second clips. So we did very attractive clips on family care guidelines, which the Assam government was very enthusiastic about. We did it in the Assamese language. So the state has taken it upon their own now. So we did quite a few innovations which added to all of this. But I still reiterate my point that the basics have to be in place solidly for things to actually matter. Thank you.
Thank you, Dr. Parija. So the point that is well taken from Dr. Parija is we need to get back to our basics. We need to regularly review the progress that we are making. And also, thank you, Dr. Parija, for sharing the innovations regarding the work that you are doing. So my next question is to Dr. Arun Kumar Jha, a very learned man. He has been working with the program and with the government health. He is the part of the system where policies are being, formed, right? So, sir has also led the National Productivity Council. So, sir, with your experience in industry-driven training solutions, what lessons can public health programs, particularly anti-EP, can learn from entrepreneurship, productivity, and industry skilling models that already exist, sir?
Yeah.
So,
I will just take a step back what we are talking. Generally, whenever we talk about capacity building, we talk about those who are existing in the system. With a lot of innovation coming in the diagnostics and treatment and, drug medication also, we need to have a capacity building for the people who are going to join. Like, TrueNat or CVNat, it will improve over the time. Then we will have a simple graduate or simple person, educated person who can put the cartridge and who can do the test, and other thing will be done by the doctor. So that is number one. The same way, with the X-ray coming in now, there's a handheld or a portable X-ray, whatever we say. We do not need the general radiologist who will undergo 2 years of courses and come back. So we need to think about that. Similarly, for the MRI operator, you simply have to put, somebody else will be doing everything. So I think capacity building for those, people who are going to join, that will also be taken into account. Now with the existing system, as Dr. Garg was saying, that we had to train several people over 100 days campaign. What happens? We have got more than 1 million plus ASA worker. Now we are thinking of TB Mukt Panchayat. We have got 250,000 Panchayat or Panchayat. How to train those people in one go? We need to have, different hybrid model. We need to have online courses. We need to have app-based courses. Otherwise, the thing will happen that, and then beside those, digital, learning capacity system which Saksham is having, similar kind of, app-based and online training courses models should be available to everybody on every phone. And then, we need to have a certification recognition also for those people. Then they will feel, elated that if I do this, I will get something like that. And moreover, what happens, these doctors, I have been to UP, this training center. I found it very large, very big. Of course, it was 7 years back, and it was lying vacant. Because they are so busy. There is almost 40% vacancy in the any NHM system. So how do you expect them to come and get the trainings? So we need to provide them training at their convenience, and at the same time we must recognize them also and incentivize also. Of course, it is a difficult task, but we have to do that. Then only they will adopt all these things.
Yes.
Thank you very much.
Thank you, sir. I'm sure the program will definitely learn and adopt and adapt the few things as a key takeaways from your experience. So my last question in this round is to Dr. Manu Mathew. So artificial intelligence is rapidly changing the way how we train the healthcare workers, right? So what role do you see of artificial intelligence in training and capacity building? And what are the different challenges that you think we can encounter to work it at scale?
Two questions. So one is,
Yeah.
what are the new potential artificial intelligence tools that can come up in training?
And what are
as
the
well as
hindrances to, yeah.
So when we think about AI in capacity building, what we think naturally comes to our mind is, can we ask Amitabh Bachchan to come and train our staff? Can we get Amitabh Bachchan to do the video and get training for our staff? Or can I put my guidelines and get training material, right? So that's the conventional things. And that is possible now. That is definitely possible now. But I don't want to stop there. I want to think a little bit ahead. Just taking on from what Dr. Parija and what Dr. Vinay was telling in relation to challenges that they face during, let's say, the CHO's training or the 100-day campaign. Let's move back 6 months and see, okay, CTD is thinking of the 100-day campaign. Okay, this is the new guidelines that is there. Now, let's say Dr. Vinay is required to train all the people. He should be able to say, okay, this many guidelines have changed. Against the existing guidelines and the existing TORs, this guideline is going to impact these 50 cadres of staff. Okay, different types of staff. The system should be able to tell me it's going to affect these many cadres of staff. If it is going to affect these many cadres of staff, what will be my resource load? How much training effort do I need to put in, to train those people? So then he'll be able to make a decision. Okay, if this much effort needs to go in, then I need to get that much output. I need to ensure that, okay, that much more notification I need to get, or that much more treatment success I should be able to get. So it's capacity building, but it's not a conventional thing that we're thinking about. So it is possible. This is possible now. You can create a LLM model to figure out, okay, this one, a new guideline against a comparative guideline and other guidelines. What is the impact on that, and what is the resource implication for it? It's possible now. That is, let's say, for the program manager. Let's go on the other end, all towards let's say the CHO. And you are able to look at, I am a CHO and this change has happened. Now, it's very difficult nowadays to have organized trainings. I think that's what, it's very difficult. Okay, call everybody to a location, 5 days, sit them and train them on a particular thing. That's a difficult thing going now. I think that's what sir also was telling. So in such a situation, can we think of, okay, now you are having training material out there. You mentioned small snippets that you're talking. Now, based on my daily activity, let's say referral of TB cases, and when that activity is supposed to happen, if the system is able to push content to me and just contextualize in my language, in the work that I'm doing, and this is also possible now. It is not something future. It is possible now for you to get against the guidelines that you modify or change, that is translated into something very contextual on a daily basis to a frontline worker there. And there is n number of things that can happen in between. It is not just the content development. It is also to mid-level program managers. Okay, I have different sets of capacity in different people do, even in the same cadre. Let's say I'm different types of doctors. You can redistribute them in a more effective manner so that you get the most yield out of this thing. So that's also AI. It is a process innovation. It is not the conventional thing. Yeah. But all of these things are processes and potential opportunities in AI. And what are the hurdles that you see? Quick comments, Dr. Manu, so regarding adoption of this technology. I think Dr. Parija also mentioned some basics needs to be there. So one of the basics is laying the foundation for these kind of things. So let's say you want to know how to redistribute or how much is the impact of this change of guidelines going to be. in order to calculate that, there needs to be foundational data. There needs to be an understanding of, okay, these are different variety of staff that I have. This is the roles and responsibilities. This is the quantity of staff I have on ground. Now, that data is important for the AI model to learn and adapt. And simultaneously, it is also important to have some sort of ground truthing, meaning, okay, what is the guideline saying? Now, if you have different sets of guidelines that talk different things, it is very important to assimilate all of them and say, what is the latest thing? So all of this is a foundational structure that needs to be laid out, on which the solutions that we talked about can be built on.
Thank you, Dr. Manu, for the interesting insights. So again, my question is to Dr. Vinay Garg. So, sir, looking ahead, what key advancement and strategic priorities is NTEP planning with respect to capacity building, say at the horizon of, if you are looking at for the next 5 years, sir, the futuristic way forward? Yeah.
A lot of thought has been put on it, and I think most of the things have also been touched upon by our panelists. So what I think and what we have been planning is, first of all, is the quantification of need and at what level we are. We have a certain number of health professionals working under the program with a certain degree of training and capacity building happening. As Dr. Parija and Manu also said, first of all is we have to quantify how much is our need. We are progressing towards 100%. We aspire towards 100%, but not even 10%. We may be at 50%. First thing I would see is we will try to, and we are trying to incorporate a system of quantifying where we stand. Then after that, depending on that, cadre-wise, content-wise, we are planning to increase our delivery of the training material. And one thing which in my very short duration of at CTD I have come across is, how do we quantify? Like, if a training has happened, if a capacity building exercise has happened, how many of those people have actually gained that amount of skill? So a certain level of quality certification needs to be built in, by which we are trying to do is like some sort of a training material a person should be subjected to. After that successful completion of that particular self-learning material, the person should be able to come on to a hybrid mode. And after that hybrid mode or in-person mode, subsequently some tasks would be given, which will include a practical training, practical exercise. After completion of that, we will say, okay, this ABC person has completed a 4-star level of course completion. So first is quantification of what is our need, and then ensuring that whatever trainings and capacity building we are doing, they are acquiring those skills as we expect. So these are the two most important things. There could be a list of many more things. So I think that would be most important.
Yeah, thank you, sir. Thank you. So, sir emphasized upon the competency-based training and the quality of training that we need to have. We need to have the basics, the basic assessment we need to do, the quantification of the training information that we need to capture, and that is the way forward, probably the beginning point. So, Dr. Lavania, so like necessity is the mother of inventions. So we know that we need innovations. So what do you think? Like where do these innovations or the innovations can make the biggest impact in improving the training execution at the state level and the trainings at the district level, sir? Key areas, yeah.
Basically, innovation is an ongoing process, and it improve the training or capacity building at different level. So area where integration of the technology in monitoring the training or capacity building from right from top to the bottom, because taking the capacity building from the top to bottom, from state or from capital to PHI level, it's very important. So like it can be, we have to develop the monitoring system of the training. Okay, how the cascading of the training is being done through the all stages, right from the district level, community health center level, all PHI level. It's a very important. So like develop the tool like TIMS. We are like monitoring the training cascading by TIMS software, and it is very effective. So in this way, like it can be monitored.
Yeah, thank you, Dr. Lavania, for highlighting the need to have the training monitoring systems in place, and that is a big innovation. That is the area we should focus on, and developing the information system like TIMS, what Dr. Lavania referred to. So my next question is to Dr. Parija. So with all this progress, reaching the last mile is still a challenge. So what are the biggest gap in training do you see, sir? And what kind of innovation can fix these gaps?
Thank you. So, especially from the CHO point of view, because we have worked closely with them, if you understand the CHO career pathway, it is kind of a dead end. I mean, they don't really have something to look forward to. There is no promotion pathway, right? Career progression is a challenge. So because of that, what we did, and when we say capacity building, it is not only technical skills, but it is also managerial skills, right? It is also leadership skills. So what we did in our geographies, in some of our geographies, is we identified a few capable. We had a set of parameters, and we sent them for something known as a mentorship training at IHMR Jaipur and AIIMS Bhubaneswar, and they came back and then they mentored the CHOs in their areas. It was like something that desperately looked forward to. They were very happy about it, and they vied for this ki mujhe banna hai. So this is one incentive that actually helped the CHOs want to undergo training and want to become good at what they do. So something like that. Then we stop at one training. We train a CHO and then check lag gaya ki CHOs trained, right? But we never bothered to really understand, do they need refresher trainings? Do they need repeats? Maybe a very context specific training. Maybe not tell the CHO the history of epidemiology of entire TB, and so we have to make that training context specific and person specific, including frequencies of when we want to train them, right? And nowadays, as Manu rightly said, there are dramatic tools that have come in. As sir was mentioning, if you want to do a hands-on training, there are VR virtual reality tools. We not the NIHFW program, but another program in JHPIEGO did something around cervical cancer screening. Right? How do you do a PV examination using a speculum? Just using a VR goggles, right? So not as good as the real thing, but then it is the next best thing that can happen, right? So maybe we can also look at those things to see if some of those can be scaled up. Thank you.
Thank you, Dr. Parija. My next question is to Dr. Jha, sir. Sir, Dr. Parija also touched upon, getting the CHOs trained, not just in the technical part, but also the programmatic part. So similar to this, what scope do you see for cross-sector collaborations for improving the capacity building in healthcare?
Actually, what happens that whosoever comes here, besides technical, he has to have a managerial and leadership quality. Otherwise, that will not happen. Any center, everybody needs to be a leader. That's why what used to happen that many, see the big celebrities, star of any firm, they will say that I need not only one Satyam Nadella, but I need millions of Satyam Nadellas who can do the work at their own level. So at every level, what happens that what I'm telling you about the training, what Mr. Parija says, that you have to build a incentive for the training. It is not necessary that only promotion or money and pay, these three P we say, pay, promotions and perks. That is not only necessary. Some kind of, recognition of his acquiring that caliber is something like, printed on the paper which is given to him, and where he recognizes that, look, he has done this kind of thing and he's good enough to do that. So that kind of cross-sector, it has to happen. Otherwise, it will not go, it will not take off. There will not be any incentive for taking that training.
Yeah. Thank you, sir, for sharing the insights. So moving on to Dr. Dharmendra Yadav. So, sir, as you explained about the section. So what we want to learn now is what is there for us in store with respect to Saksham, what new innovations, what new development Saksham is going to come and going to revolutionize the training training infrastructure across country. Yeah.
So we are seeing the like last 2 years we are almost stabilized the portal and seeing the new advancement in the Saksham portal. We are working we have a plan for next 6 months. So we are working in two direction. One domain is the technical aspect, another is content in terms of content of training modules. Which can NIHFW can support to the program divisions, right? So in the technical aspect, Saksham portal currently we have developed the mobile application, that is Android is live, and we are also working in the iOS application, so that will also run live in the within 1 month. So with the help of these mobile application, the more reach can be done with the community level, ASHA and ANM. So at the ground level you can it will enhance the reach of this portal. You can do that. And the second thing is we are also working in the also working in the area like we can convert the content in the regional languages, because we are making our portal which can change the languages, and training modules can be done in the regional languages. So we have done some MOU with some Northeast Council, and MTRON is there. We have MOU with the these Northeast organizations with NIHFW, and in the MOU we have they have promised to do the enhance this type of support to the NIHFW. And currently at Saksham we have the this self-paced already recorded videos and everything. So for next time we are also working in the for the instructor based learning or training, as well as for the live classes, right? So if you want to make any live session for the any healthcare workers, so you can directly host yes through the app, as well as this one. Then we are also working for the integration of Sashakt portal. So Sashakt portal is currently managed by the NHSRC, which is capturing the physical trainings which are happening in the states. So as per the ministry's mandate, we are also integrating with the Saksham, so that there should be physical trainings as well as online trainings. So both the data should be with the program division, right? So can identify. Then we have for the content creation. So we are happy to announce that before one week, Honorable Minister of State Mrs. Srimati Anupriya Patelji has inaugurated our digital learning media lab at NIHFW. So now the biggest problem for development content is recording of the sessions content, because we have the portal but we don't have any mechanism for recording of the content. So you all are welcome. You can come. You can send to your experts at NIHFW or Media Lab for the recording of the sessions, recording of the online training modules for hosting. So this is the one you can say that whole package is there at NIHFW. So thank you.
Thank you, Dr. Yadav, for sharing us the new features that Saksham is coming up with. So my last question is to Dr. Manu Mathew. So, Dr. Manu, looking to the future, how do you see the emerging technologies like virtual reality or the simulation-based learning shaping the next generation of TB training and capacity building? These are all the new methods. We have been watching movies or virtual reality things. So, how do you envision that as a part of the training?
I'm going to talk from a programmatic sense, right? Programmatic sense, I don't see at this point of time. There may be some innovator who comes and disrupts the thing and creates a new thing. But at this point of time, I don't see any AR, VR coming and attaching this. But simulations does. Simulations do. Simulations as in based on, let's say, my performance. Based on my performance, you can use AI or data analytics to figure out if I get this sort of training in a certain scenario. I can be given a scenario, and in that scenario, I can perform and get a result out. So scenario-based training, so case-based learning, let's say advanced case-based learning would help. So based on the work that I'm doing, AI can create scenarios for me and ensure that the work that I'm doing is the most effective. Like I think so was telling, we are training people, but are they actually changing their practice, right? So scenario-based things may help there. But as of now, in program settings where there may not be things that can be modeled or something, may not have AR, VR, may not be that applicable, but we have to see from innovators. We do not know what we do not know. So somebody might just come up with something entirely different from what we do not know of.
Yeah, thank you, Dr. Manu. So we had the variety of views from different stakeholders, starting from the program at the center level, the learnings we had from the state level, from the field level learnings we had from Dr. Parija, the different intersectoral collaboration and the skill-based learning that Dr. Jha emphasized, and Dr. Yadav briefed us about the new developments regarding the Saksham platform, and Dr. Manu gave us insight about the AI and the futuristic ways of learning. So we can take one or two questions from the audience if they have to our esteemed panelists. We'll be happy to accommodate one or two questions max. Anyone? Okay, Jari ke time. Yeah.
So my question to STDC, I think Director STDC is that because the objective of STDC is basically to drive this capacity strengthening, right? So how prepared STDC is in terms of observing or adapting new technologies to improve further learning, right? Because particularly in medical, of course, even otherwise in social also, like there are so much of new things are coming up, right? So so I'm just in the interest of time, but straightforward to you, sir, that how STDCs are in a position to really grasp those things. There are partners, there are governments, all sort of enabling factors, but at the end of the day, it is the STDCs which has to drive. Yeah, over to you, sir.
As I told you earlier, कि change is the basic nature of the life or anything. So in training is also we are adopting the new things which are coming, any form of the change which improve the performance of the STDC, which are supposed to do deliver in form of the supervision, monitoring, and training and diagnostic method. So we have IRL lab also. So in every aspect we are always ready to adopt the new things. So we don't have any obstacle or hindrance in adopting new things.
Any more questions? Yeah, Sumita.
Yeah, attitude matters. Yeah, definitely.
Thank you. I just want to take the question to NIHFW, Dr. Yadav.
Yes.
Because we have been talking about content-based training so far and how we deliver over multiple platforms using hybrid models also.
Yes.
But what about skill-based training, and what is the plan for NIHFW to impart such trainings through the Saksham or the other portals which you are talking about?
So currently, ma'am, we have created the skill lab. To nahi hai abhi, we have sir audio video recording. So you can record your sessions at our lab, and you can host it on the Saksham. But the way forward, we are also working into that for the skill based. Although when we have a National Medical College network as well, which is a very it's a skill we have at AIMS Delhi, because this platform is hosting more than 300 clinical courses as well. So this is for the public health courses as well as clinical courses, because it is also used for the medical education of the MBBS students. So there is a National Medical College network. Its National Resource Center is located in the this set facilities there in AIMS Delhi. Dr. Ambuj Rai is the nodal officer. They are managing the clinical courses, and they are also creating this kind of skill related courses. As per now in NIHFW, we are dealing with the public.
So I thank the audience and the panelists. Yeah.
Thank you so much, Dr. Abhimanyu, for moderating the session, and thanks to the panelists for such an insightful session. I would now request Dr. Abhimanyu to please hand over the mementos to the panelists.